Hey there, I'm back. It's Dr. Hart again, Nursing with Hart PhD. I have a few more questions on leadership management. There's a couple on ethics, delegating, and what are the nurse's priorities? Okay, so let's get started. The nurse is caring for the assigned clients for the day. The nurse fulfills the needs of 3 of 4 clients, and because of time constraints, is unable to fulfill the needs of the 4th client. Which ethical principle has the nurse violated? Okay, here are your answer choices. Number 1, justice. 2, fidelity. 3, veracity. Or 4, beneficence. And we'll give you a minute to think about it. We'll come back. Okay, let's come back to this test question. These are ethical terms. Okay, and the correct answer is number 1, justice. Okay, so when the nurse fails to follow up on all of the client's needs, some of the assigned clients, but not all of them, then justice has been violated. Okay, justice is the equitable distribution of potential benefits and tasks that determine the prescription and which clients would be cared for. Okay, fidelity is to keep your promises, to do what the nurse has promised. Veracity is the obligation to tell the truth. And beneficence, remember the word benefit. Beneficence is the duty to do good to others, maintain a balance between benefits and harm. Okay, let's look at the next one. The registered nurse understands that in general certain invasive tasks can be delegated to which member of the healthcare team? Number 1, ancillary personnel. 2, a licensed practical nurse. 3, unlicensed assistive personnel. 4, any healthcare provider. Okay, we'll give you a minute on this one to pause and think about what you think the answer might be. Okay, let's come back to this one, and the correct answer is number 2, a licensed practical nurse. So the key words in this question are certain invasive tasks. Okay, invasive tasks. In general, the RN can delegate certain invasive tasks such as dressing changes, suctioning, urinary catheterization, and medication administration according to your state or agency policy that applies to LPNs and their scope of practice. Ancillary personnel would be like maintenance, housekeeping. They're not typically involved in direct care. The UAP or unlicensed assistive personnel can perform non-invasive tasks in the client's care. And the RN does not delegate to any healthcare providers. All right, let's look at the next one. The registered nurse working in the long-term care facility is planning client assignments for the day. Which priority considerations should the nurse remain mindful of when preparing the assignments? Okay, number 1, client safety. 2, tasks that can be delegated. 3, individual variations in workability. Or 4, matching tasks to the appropriate worker. Okay, I'll give you a minute on this one, and we'll come back. Okay, on this one, don't get tripped up. The other, some of the answers sound like they may be correct. So you're looking for the priority consideration when the nurse is preparing the assignment for the day. So in other words, when the charge nurse, for example, is assigning for the day which patients would, or which other nurse or other personnel could be delegated to perform certain tasks. Okay, so and the answer is number one. Client safety is always the priority consideration when planning client assignments is client safety. Okay, the nurse should also consider if the task can be delegated, individual variations, workability, and matching tasks to the appropriate worker, but these are not the priority considerations at this time. Okay, always think client safety. Next one, the nurse understands that the central concept within the ethical principle of justice is identified by which description? 1, to remain truthful at all times. 2, the obligation to cause no harm. 3, the order in which clients are cared for. Or 4, to maintain a balance between benefits and harm. Okay, we'll give you a minute to answer this one. Okay, let's come back. The correct answer on this one is number 3. Justice is the order in which clients are cared for. Okay, it's the equitable distribution of potential benefits and tasks, determining the order in which clients should be cared for. To remain truthful at all times is the ethical principle of veracity. The obligation to cause no harm is non-malfeasance, and to maintain balance between benefits and harm is benefits or beneficence. Okay? All right, one last one. When prioritizing the care for a group of clients, the nurse should remain mindful of which item as the highest priority. 1, safety needs of the client. 2, spiritual needs of the client. 3, client perception of time. Or 4, physiological needs of client. And we'll give you a minute to think about it. Okay, let's come back. And the correct answer is number 4. The priority here and always, according to Maslow's hierarchy of needs, is the physiological needs of the client. Always. Now you may have looked at this one and saw safety first and thought, oh, safety, always think safety. But you have to read all the answer choices carefully because the highest priority are the physiological needs of the client. The safety and spiritual or psychosocial needs would follow after the physiological needs. The client's perception of time is important, should be addressed, but again, the physiological needs come first. In this question, you would remember the concept of Maslow's hierarchy of needs, okay, that are physiological, safety, longing and belonging, self-esteem, and self-actualization. Okay, so physiological needs are always priority when you're thinking about Maslow's hierarchy of needs, when you're answering test questions. All right, I hope you enjoyed it. So I'm going to be doing more later on. Keep an eye out for the next one, and we'll see you in a little bit. Take care and have a great day.